845, 55 KRCD Talk Station. Always love having the cancer specialist from OHC in studio to talk about the amazing developments they have in treating cancer. But for having Dr. Patel, my cancer doctor, in the other couple of weeks ago, I wouldn't have gotten an appointment with her because I have some symptoms which led me to find out that, yeah, my cancer came back. So this is a wonderful segment. Pay attention, because you get some symptoms and some information. It might save your life. It is Breast Cancer Awareness Month. Breast cancer impacts 1 out of every 8 women, accounts for 30% of female cancer cases each year. Second leading cause of cancer deaths in women, surpassed only by lung cancer. In studio, OHC breast surgical oncologist Dr. Abby Tremelling is here today to share the latest treatment news and success OHC is having in treating breast cancer. She's a fellowship-trained breast surgeon who treats both benign and malignant breast disease. It's wonderful having you in studio, Dr. Tremelling.
Thank you for having me.
My pleasure. Let's talk about it. What should women be doing to prevent breast cancer, and who is the group that's most at risk?
Unfortunately, you can't always prevent cancer. However, by not smoking, limiting alcohol intake, and maintaining a healthy body weight through diet and exercise, you can reduce your risk somewhat. Additionally, knowing your family history, making sure you're doing routine screening exams, and being knowledgeable about your own body can help catch a cancer early.
All right. In terms of screening, what is the state of the mammograms? I mean, when do women get? This is like a moving target all the time.
It is a moving target. There's so many different guidelines out there, but the most recent updated guidelines are more in line of what we've been recommending as cancer doctors for the last several years, and that's for average risk women to start at age 40. They say every other year, but I still recommend every year. But as long as you get in at age 40, we can help guide you after that.
Okay, well, some segments of the female population are more inclined to get breast cancer. I understand, for example, African Americans have a higher risk of developing breast cancer.
Yes, and unfortunately, they're more commonly diagnosed at a later stage and are more likely to die from breast cancer because they have more aggressive breast cancers often seen, and they're often actually diagnosed at a younger age compared to white women.
Really?
Mm-hmm.
Any specific reason for that? Pull a little closer to that microphone.
We don't quite know all the reasons, but that's why we're certainly wanting to increase awareness about screening and then being aware of your body to do self-exams, because if you're diagnosed before 40, it's normally not because of a mammogram.
All right. Well, now, in terms of self-exam, is there a best practice for how to do that?
Typically, women do it in the shower, which is a great option to do it with the water. Your fingers can just glide over the breast more easily. And then, of course, you're looking for a mass, but you also want to look for changes to the breast itself, which you could notice maybe in the mirror. So if the breast is swollen, red, if there's changes to the skin, if there's changes to the nipple, retraction or crusting of the skin of the nipple, or if there's clear or brown red drainage from the nipple, those could be clues.
All right. Those are the things that people need to be looking for. And again, I went over a list of symptoms for, lymphoma with Dr. Patel, and I had some of those. So swelling, skin dimpling, breast or nipple pain, nipple retraction, nipple or breast skin that is flaky, dry, or thickened, nipple discharge, swollen lymph nodes under the arms or near the collarbone. Check the list, see if you have any. And if any women notice that any of those conditions are present,
call your doctor, get evaluated. We'd rather see you and it be nothing than put something off and have a later diagnosis.
Amen. You don't know how happy I would have been if I saw Dr. Patel and she said, nope, it's okay.
Right. We love those visits.
I lost an hour and a half of my time. Okay. And I got a prognosis that would have put a smile on my face. But then again, it didn't go that way. But I'm glad I found out when I did. How about treatment options? Every time the OHC folks come in here, there's always some exciting new treatment options and really an injection of hope for people who get a diagnosis.
We really try to tailor the care to each individual person based on what type of cancer they have and what specific scenario they're in. But for breast cancer, you typically meet with a breast surgeon first, and then we work with a multidisciplinary team of other doctors to help coordinate the best plan for each person. Often it includes surgery, some form of radiation at times, or chemotherapy, some other targeted treatments like hormone therapy or immunotherapy too.
Okay. I'm looking at, say, for example, nipple retraction or a discharge. Is there going to be a lump or something in all cases that would be biopsied, for example? I mean, is there always some, literal cancer right there that's causing that that visual thing that's going on outside the breast?
Correct. Normally, if you see some visual change to the breast and then we get imaging, we find something deeper on a mammogram or ultrasound. Sometimes, if it's not clear, we might get a breast MRI, and that helps figure out something that might not be as clear as a mass, but some other change in the breast that could be causing that outward physical change.
Okay. And I guess absent outside physical change, if there's not a true lump there, then there's nothing that you're going to be able to detect by way of self-exam.
Right, unless there's like a dimple in, it could just be because there is a deeper mass that you can't feel, but maybe it's either hidden by dense tissue or deeper in the breast so you can't feel it, but something's causing that physical change.
The dimpling.
Correct.
Okay, that makes perfect sense. Now, women younger than 40 still need to do the self-exam, even though there isn't an annual mammogram recommendation that begins at 40. But the self-exam, at what age should that begin? I mean, can this cancer kind of go after young people in certain cases?
It can. It's, of course, very rare in our 20s. It's getting more frequent, unfortunately, in our 30s. So sometime in our mid-20s is probably a good time to at least be aware of a woman's breast so that we can notice changes from month to month. We typically say to do an exam once a month so that you're not checking every day and kind of spending too much time on it, but that you will notice a change more frequently if something were to happen.
Well, I imagine moms out there might want to start their daughters on a protocol at a young age just to get them used to the idea and get it embedded in them that they need to check at least every once in a while, be aware of the fact that something could happen.
Exactly.
All right, now on to the treatment options. What are the treatment options, which quite often include, and I've learned over the years, clinical trials may be the best place to be, but I've also heard about CAR T therapy and other different therapies that are emerging and are often unbelievably successful.
Yes, there's so much going on in cancer treatment right now. For breast cancer, there's many clinical trials. We have several at our offices. One of the more exciting ones is about a vaccine that can be used for people who have already been treated for breast cancer but might be high risk for recurrence for certain types of breast cancers. But there's always new trials that we get every few months. So it's important to, just talk to your doctor about the options for that, and, we'll bring it up for those that qualify.
Well, I suppose getting on it earlier is critically important because breast cancer is one of those cancers that can metastasize.
Absolutely. That's always the goal, to catch it early when it's most easily treated and cured.
Well, how about you said that the number of younger women in their 30s that are being diagnosed with breast cancer is increasing. Are people doing research into why that may be? Environmental factors? I mean, I read a lot about plastics and carcinogens and the packaging materials. I mean, there's a multitude of potentials, but any insight right now?
I think we're all just thinking the exact same thing you just said. We don't have an exact reason, but it has to be some environmental exposure, whether it's certain, chemicals that we use that change the hormones in women's body, change their menstrual cycle, whether it's earlier, that is a risk factor to have an earlier menstrual cycle onset.
Really?
Mm-hmm. Younger age for menstrual cycle beginning, or later age of menopause, because it's a higher exposure to hormones during your lifetime.
Now, is there hormone therapy that can be done in terms of your breast cancer treatments?
Yes. We call it hormone therapy. Sometimes we call it anti-hormone therapy, but it's directed for hormone positive breast cancers to help treat those, which is the most common type of breast cancer that we see.
Oh, I'm glad I asked that question. On to clinical trials. OHC is well known for having clinical trials going on all times for all different types of cancer. Do you have any clinical trials right now for breast cancer?
We always do. We probably have several at the moment right now. Some are for earlier detected cancers. Many are for metastatic breast cancer. It just depends on the type and what other treatments you've already had. But yes, there's always many options.
That's where you need to be, OHC. And to be there, get an opinion, a second opinion, get in touch with them right out of the gate. That's 888-649-4800. 888-649-4800. You can learn more online and check out the website. It's ohcare.com. My cancer doctors, I feel like I'm in wonderful hands, and I'm very confident with my treatment protocol that's coming up, even though I don't know what it is yet. But you did well by me before, and I'm certain that everything will be okay. So, ladies, if you're struggling with this, and it's actually guys too, but it's a rare occasion with guys.
Right, more rare, but can still happen in men.
So maybe occasional breast exam for men.
Yep, certainly if you feel something, let your doctor know.
All right, check down below and then check up top, guys. Make sure you're staying out of trouble. 888-649-4800, ohcare.com. Doctor, it has been a pleasure to have you in the studio. Thanks for what you're doing for all of your patients and everything that OHC does for all of its patients. It's been a pleasure talking with you today.
You as well. Thank you.
Spread the word, folks. Breast Cancer Awareness Month. You can save a life by passing along that information.